What's up, guys? Welcome to another live chat or a chat on the YouTube. And today we're going to be talking about movement, how to move better to feel better. We do one thing the way we do everything. The way we move throughout our room and our day mirrors the way that we're going to actually move throughout our life. The more connected and present we are with our movement, the more connected and present we will be in our lives. And as we figured out by now, the more present we are in everything that we do, the more that we get out of it, the better that we feel, and the better that we will perform as well. This conversation that we're going to be having is going to be awesome for anyone who is looking to move better, improve their posture, or especially if they're suffering from any sort of joint or body pains from their ankles to their knees to their back to their shoulders. Most of that is just a cause of imbalance of improper movement. Or if you are an athlete just looking to move better and recover faster, this is also going to be an awesome conversation. And you can join in and ask any questions you may have if you are on this live chat, or if you're on a later showing on YouTube, you can put any comments below of any questions or suggestions you may have, and we're pretty good at going back and answering those questions. Your main host, is Will Grant, professional BMX racer, fitness enthusiast, just all things on movement and breath and how to improve myself to help you guys. And this is co-host Dr. Edwin Adams, just an absolute awesome human being and a leadership alchemist that helps us all become the best version of ourselves and is the man behind the scenes to really make all this possible.
What's up, Will Grant? Happy Thursday, my friend.
Yes, sir. How are you doing today?
Oh, what a great day to be alive. I was always excited about Thursday because it is my Thursday. When I remember the superhero within me and acknowledge the superhero within the people in my network. But man, Thursdays are like 2 times now because I have a chat with Will Grant in the middle of the day that just makes everything right in the world. So what a privilege to be back with you.
Yeah, well, thanks for being here, and thank you for the kind words. I always look forward to my Thursdays to not only be able to connect with you, but connect with people all over the world who are interested in getting better and feeling better.
Absolutely. I'm so glad we're talking about this topic today, Will, because over the past probably 2 months, I've had really bad elbow problems that I thought was bursitis or tendonitis or something. And I find myself asking all my people in healthcare, what would you do? And, probably half of them suggested, well, just take 2-3 weeks of ibuprofen and, it'll get better. And then another would say, oh, you need to go to the doctor and get some orders for physical therapy. Or one of them even suggested that I take off moving and rest for 2 weeks to let it heal. So goodness gracious, don't even get me started on all the Googling I did to see what attaches where in the elbow in order to see what that is that was hurting. But no one that I asked suggested that part of my daily practice should be paying attention to how I move through space as a cause for my elbow problems. So that just got me thinking, wow, we are talking about something so relevant that can impact people's lives so much from a preventative standpoint. So it doesn't have to get to the point where you're in dire pain and have to rely on the healthcare system to fix you. So yeah, this is a great conversation, Will.
Yeah, unfortunately, the healthcare system doesn't really seem to intend to get people healthy. They just want customers and lifelong customers. That's why they tend to go and attack the symptoms first. But nothing in nature really works that way. If you just do things to mask the symptoms, like taking ibuprofen or just resting it, as soon as you get back to your normal daily activity, that problem's just going to come up again. And it's going to keep coming up until we figure out what is the root cause that originally caused that elbow to be bothered. Because pain is just a signal. That's our body trying to signal our brain, hey, pay attention to me, and our bodies are speaking to us all day, but most of us don't really understand the language, so we're not really listening to it. And we only really hear our bodies when it's absolutely screaming at the top of its lungs, hey, hey, hey. And then we're like, oh, what do I do? You know, you may go to a doctor and they give you a pill or a procedure or something, but at the end of the day, you still don't know what caused the pain to come up. And the pain will keep coming up until we figure what sort of imbalance is in our daily routine that is causing that issue to start. And most of the time, or pretty much all the time, of every case that I've seen is either caused by one sort of traumatic incident, you know, like a wreck or a car crash or some fall, and or some sort of bad movement patterns or bad movement habits. And a lot of times a crash or a sports injury or some sort of fall earlier in our lives builds up a lot of bad habits of movement that cause pain maybe 5-10 years later. But either way, we have to find what sort of movement patterns is causing that chipping or that grinding away or that pain of that nerve signal telling us, hey, something needs some love and attention.
So you tend to be going back to a level of awareness. We talked about this with breath, that awareness is really key to instigating a new way of breathing, and it's also a new way of movement. I would have never thought that I was moving perhaps in a bad way that caused my elbow problem. So that's an awareness issue. So, you know, just walk through me there from your expertise. If someone has an elbow problem, what do you initially go to try to discern what they're doing that might have led up to that?
Yeah. So that's a super good question. So what the medical industry doesn't really take into consideration is that everything is always connected, you know? So for example, if you have elbow pain, you want to look at what's going around the things around it. So your wrists, your shoulders, you know, where your posture is sitting. And most likely what I've seen probably 95% of the time with people with elbow pain, it's connected to shoulder pain and connected to people who spend a lot of time on the computer. Because when you're on the computer, you're here. Your shoulders are rolled forward, your neck is pushed forward, your elbows are turned in like this, and that just puts everything out of a line, you know? And just to become aware of how you're sitting in that moment can do wonders on just how you're feeling in that moment. So the first thing I would do is just become aware how you're sitting. If you have shoulder pain or elbow pain or wrist pain, it's most likely because you're in this position too much throughout the day. So first things first is you want to have the bones stacked. If your head is above or in front of your chest, in front of your heart, everything is pushing that weight forward. So it's throwing everything out of a line where all of your muscles around are having to overwork. Alexa, pause, please. Sorry about that. But so first things first is having a nice tall neck and bringing that chin back. And that alone will take so much pressure off your shoulders and so much pressure off your elbows from trying to keep it to pull back. And then two, which is probably the most important if you're having elbow issues, is you're here. You want to learn how to externally rotate your arms and shoulders, okay? And this is a challenge. Most of us can't really do that. But I'll show you a quick little exercise. And like I said, if you're having elbow pain, it's very related to shoulder pain or neck pain or upper back pain, or even once this gets a little bit more serious, and if you don't do anything about it, you might start to get numbness or tingling inside your hands. And that's when you know you really got to do something, because it's not getting that blood flow. It's not getting that movement because you're here. So most importantly, I'm going to have to take my shirt off for this one, but most importantly, look from a side angle. Okay. Let me try to get into a position where you guys can see me really well. Okay. And first you want to bring your head up. Okay. If your head's here, pretend like there's a string pulling your head up and you bring your chin back. And then 2 is getting those shoulder scoops. 2 is extremely, extremely important, is learning how to scoop your shoulders. So if you're naturally here, your shoulders are really tense and your shoulders are rolled forward, it helps to reach those hands out as far as you can and then just turn those hands out and try to focus on pointing your armpits to the front of your room or externally rotating your elbows. Like for example, if you're in a plank, if you're here, you're turning your biceps forward without moving your hands. And what that does is it just puts your shoulders in such a better position if you see it from a back angle. So instead of here, you're being able to scoop them down. And what you're doing with that is you're going to be engaging those muscles that take all the pressure off your neck and all the pressure off your shoulders and elbows, and you're going to be opening that up so you're getting so much more blood flow, so much more oxygen, so much more lymphatic fluid drainage throughout your body so things can recover and things can flush and nourish and hydrate, as opposed to here, it's kind of having like all those rivers clogged up, or like a dam in a big river, when you want those veins and just flowing and moving freely throughout your body. So you want to open that chest up, chin nice and tall, chest out, shoulders scooped down. And this is a practice that you want to be practicing through brushing your teeth instead of here, on the computer instead of here, doing the dishes, whatever you're doing, just try to scoop those shoulders forward, chin back, and that's just going to take so much pressure and put your body in a position to really heal. Okay?
You make such a good point, Will, because these symptoms started about 6 weeks after quarantine started, when I was in the office all day long, and I wouldn't have told you that sitting here at my computer would have been the cause of my elbow pain. That is an awakening moment right there, because I'm not paying attention to my shoulders or my scoop when I'm at the computer. That's a great idea.
What's the crazy thing is a huge amount of our pains throughout our body will always come down to not always, but most of the time come down to sitting. Sitting is literally the new cigarette. It just puts our body in such a compromised position that closes up all of that flow that should be moving, that energy should be moving throughout our body. It closes that up. It keeps that stagnant. All that blood is not circulating. It's not moving, as opposed to, and that's on the car, driving, whatever you're doing, you're just in such a compromised position. That's why, like the standing desks are great, but what I think is even better is just sitting on the ground, and that's a whole other topic that we can go into a little bit later. But the more time you spend on the ground, you're forcing yourself to, one, constantly move, to adjust, to get comfortable. So you're constantly flushing that, lymphatic fluid and getting that nourishing blood and that hydration into all of your joints. But your body can reset and rebalance when you're just on the ground a little bit more.
Well, now you've got me curious, Will. I'm wondering if there are other things I'm doing. Do you go through a checklist of some sort to kind of make sure you're in alignment? Because clearly I know I need to do some better things driving as much as I do, and definitely at the computer. What is there a sequence you can recommend maybe?
Yeah, for sure. So for what I like to do, that I actually learned from the guys from Move University, which are super, super smart guys, and I'll show you. And this is like a 6-point posture checklist that you can check into at any time of the day. And I know at first it's going to seem like, okay, well, that's a lot. I can't be thinking about that all day. But if you just learn it and start thinking about it for a few weeks, your body will just naturally sit better into this position. And then when you're out of the alignment, your body will just say, hey, that doesn't really feel that good. And you'll know to go right back up. But let me see, you can see me perfectly here. All right, so you got the first, where your head is nice and tall and back, right?
So that's first.
Can you hear me okay?
Yep.
Okay, and then 2 is scooping those shoulders, so your shoulders are away from your ears and they're down and back, so they're scooped, right? And then 2 is, a lot of times if you scoop your shoulders, this will come out like that. So you want to brace that core. Okay? So first step is tall head. Second step is scoop shoulders. Third step is brace that core. And fourth, which is extremely important, is pelvis neutral. So many of us are either anterior or posterior too much, which is caused by, you probably guessed it, sitting. Okay? So just to be able to put yourself through that little range of motion, anterior and posterior, and find that neutral position. You know, our bodies are really amazing to where if we put ourselves through a full range of motion on a continuous basis, our body does a much better job at just sitting in the proper position, okay? So number one was the head. I highly recommend writing this down because if you write it down, it just helps you remember it so much more. So number one is tall head, chin back. 2 is shoulder scooped. 3 is core braced. 4 is pelvis neutral, okay? Now, the 5th one is engaging your glutes. Just how you embrace your core. When you engage your glutes, watch what my knees do, okay? When I engage my glutes, my knees go outwards, okay? And that's very important because so many of us, again, from sitting on couches and chairs too much, our glutes just completely turn off and our hips get extremely tight. So it puts our knees and our back in an extremely compromised position. But when you engage your glutes, your knees go outward, and that's that strong, stable position, that athlete stance to where you can handle anything, okay? And now the last one, which may be one of the most important, is learning how to grip the ground with your feet. So many of us from wearing shoes all day, we can't really wiggle our toes or grip the ground with our feet. So strengthening your feet is super important, but that's a whole nother topic. So you want to be able to grip the ground like your hands, and then just like that external rotation, you want to do the same thing with your feet, and that brings your knees out and glutes engaged. So as you spread your toes, you grip the ground with your feet, engage your glutes, and that's what's gonna bring your knees out a little bit more as well. And like I said, at first that can seem like, all right, that's a lot, but it's really not if you just start from the top and go to the bottom. And once you consistently do this on a regular basis, it's gonna become a lot more natural. So it's the head nice and tall, shoulders scooped, core braced, pelvic neutral, glutes engaged, and gripping the ground with your feet. And you should do this position or these checklists throughout anything at first. Dishes, driving in the car, walking your dog, walking in general, having sex, going to the bathroom, eating, every little thing that you're doing, just the more aware you are in your movement, the more aware you will be in your life, and the more control you will have over whatever you're trying to accomplish by just learning how to move and use your body. And if you're suffering from any sort of elbow pain or shoulder pain or back pain or knee pain, the first thing is to become aware with how you're moving. Okay, you want to become aware and start listening to what your body is trying to tell you. And the first step is awareness. And if you just constantly try to remember as much as you possibly can, okay, how am I sitting? What's my posture like? And then just recorrect yourself into that, that straight line, bones stacked, and do that on a consistent basis, then you'll just start feeling better. You'll actually have a lot more energy because you're so much more efficient with your energy and your recovery as well.
So energy efficiency, that almost seems like a whole other topic. I would not have associated energy conservation with the value of this 6-point checklist. Can you go a little bit more into that on how we save energy through more effective movements?
Yeah, so if your body is in a compromised position, so many of your resources are just working on cleaning up that mess that you are constantly giving yourself. I don't know the exact numbers, but let's say our head. Do you know how much our head weighs, Edwin? Was it
I want to say it was 10 pounds.
Okay, so let's say 8 to 10 pounds. And, I read this in the Align Method book the other day. I don't quite remember the exact numbers, but it's something like if your head is just 10 degrees more, it goes to like 20 pounds. 30 degrees, it goes to 40 pounds. 40 degrees, it comes to like 50 pounds. And that's an extra 50-pound weight that your back has to control, your arms, your shoulder, like your whole body is having to be compromised because just something is out of a line. And as opposed to when everything is aligned and everything is stacked and moving well, all the blood and all the energy is just moving and flowing throughout that body so much better. So it's easier, like it's easier for your body. It's easier for your mind and everything to go through those movements.
So what I hear you saying is that muscles are having to do a function that they're not normally supposed to be doing from a structural standpoint. You're using back muscles to hold up your head when it's not necessary. Your head should be straight and held up by another set of muscles, not your back muscles.
I mean, I don't think your head really needs to be held up if it's stacked.
Yeah.
And that's the whole point, right? So like if your head is stacked and your shoulders are scooped, everything is in a line where, it's not having to do that extra work. But if it's falling forward, then all of these muscles get too tight. All these muscles are overactivated. They're turned off. Everything gets out of balance. And then if that is chronically going on, it's going to cause some pain.
Yeah, interesting. So what are the top 3 pain points most people suffer from, and how can you bring awareness to them? Like lower back pain, knee pain, and neck pain.
Yeah.
We talked about elbow, so let's cover some
perfect
more.
example. So like neck pain is going to be related to the shoulder pain and the elbow pain because it's all right there. You always want to be aware of what's going on around it. Most likely if you're having neck pain, your head's too far forward and those muscles are just having to work so hard by just trying to keep your head on.
Yeah,
right?
and technology's doing that. I noticed my mother this past weekend, her head was forward looking at her phone. And, she was so tight back here. When I said, Mom, do your shoulders or neck hurt? She says, oh, all the time.
All the time. Yeah. Yeah. Chronic pain is from chronic bad movement, So the one thing is, and that's same thing for your back and for your knees. If those are falling forward, what do you think, is holding that weight? Your back. And then everything's collapsing right into your knees. So first things first is just becoming aware of your body, and that's good for your back and good for, your neck, your knees, everything is become aware and check into those 6 posture checkpoints as often as you possibly can. 2, we're actually going to go back to floor sitting. Floor sitting is probably the best thing that we can do to reset and to rebalance our movement patterns. Like for example, in the third world poor countries where they don't really have all the couches and the big chairs and the thrones, they're not really struggling so much with getting up and down and body pains and osteoarthritis and all of those things because they spend time on the ground. If your back is hurting, you probably have tight hips. If your knees are hurting, you probably have tight hips and everything is out of line and out of balance through everything. But as we sit on the ground, one, like if you're sitting on that bare ground, everything that's too tight is going to be being stretched. And everything that isn't usually activating enough throughout the day is going to have to turn on to hold that posture. So by sitting on the ground as much as you can and sitting off a couch and off a chair as much as you can, that's going to help just relieve so much of the pressure and rebalance, just a lot of your body.
So Will, it's uncomfortable. So I know people will probably not enjoy sitting on the ground at first. How do you orient yourself to a different way of sitting so it's not as painful?
Yeah. Start in increments. Do what you can, So like if you have a habit of watching TV at nighttime, as much as that as you can, if you're going to watch TV, try to watch it on the ground. Get off the couch. That couch isn't helping your body recover. It's just making everything pause and sit and age and deteriorate. So get off the couch because a couch will never help you recover. Your body's going to recover so much better when it's on the ground. And I highly recommend 30 minutes. Try to have 30 minutes a day on the ground, just sitting and breathing, and your body will tell you what's tight. A lot of times, if you're really tight and if you've been sitting on couches for a very long time, your body's not used to going past that 90 degrees, because we're stuck in that small little plane of standing up to that half sit. And all of that it turns off so much of our movement, and it limits us so much in our ability to transfer that blood and transfer that nourishment. So getting on the ground, trying it 30 minutes a day, if it's 15 minutes in the morning, 15 minutes in the evening, it'll do absolute wonders. And another thing that's extremely important is, and this is where it becomes individualized, right? Because your routine is going to be different than mine. So you're going to get muscles that become a little bit tighter in different places than mine. Pretty much all of us are sitting too much, right? So just the ground sitting is going to be so much better. So pretty much all of us are sitting too much. But we have to know what are the repetitive movements that we're doing the day. So by understanding what your job is. So for example, if your job is at a desk in a computer all day, you got to get that body moving and you got to open up that chest, because you're going to be here too much. Your hips are going to get tight. So you have to just become aware. It's always going to come back to being present and being aware of what are the repetitive movements that you're doing. And then you want to do something to take care of that, either every evening or every morning, or just throughout the day. Just getting those movement, that blood flow in, is going to help you so much. Not only feel better physically, but you're going to feel a lot better mentally as well. What's that saying that Jim Quick says is like, when your body moves, your brain grooves, or something like that?
Oh, interesting.
Yeah. So like, your body makes the connections with movement. That's why movement is so important. If you're sitting still, your body has a hard time, or your brain has a hard time to making new connections.
Well, I was reading in a medical journal not too long ago about a similar topic, and it suggested that one of the greatest contributors to mortality in the US and chronic illness are our recliners.
Yeah.
That
Yeah.
we're
Those are
reclining.
so bad. Like, you're literally, you do these repetitive bad movements and bad posture all day. And then you go home and you're so drained, you just sit in that couch and sit into that recliner, which literally molds your body into the bad postural patterns that you did all day. It literally just makes it worse and worse and worse. I remember, because there was a time where 4 years where I was sitting on the couch a lot. I had a girlfriend, I was doing all my training and I was doing my stuff. And then at nighttime, we just sat on the couch and watched TV. And that's really when the downhill spiral really began to happen, because it exaggerated all of the imbalances from my training and my bad posture, because it literally molds you into whatever those bad movements that you're doing. That's why it's like we're trying slowly to throw away as many chairs and couches as we can, because it's not helping you recover. It's not doing anything good for you. Sit on the ground. And if it's uncomfortable to sit on the ground, probably means you need to sit on the ground more. And the more you sit on the ground, the better you're going to feel, and the better it's going to feel, and the more blood flow and oxygen you're going to be able to get, and the slower you're going to age.
So, Will, compare and contrast for me the way you're sitting now to a position you put yourself in a few minutes ago, where it was a full squat, with your feet on the ground and your butt behind you. What's the difference between those two sitting positions?
As opposed to like a squat sit?
Yeah, that's it. And what is it supposed to look like, I guess, is one question. What is the squat sit supposed to look and feel like? And then number two, do you just move between sitting with your legs crossed to a squat sit and back and forth? Is one better than the other, or stay in that as long as you can?
The trick is the diversity, right? And when you're on the ground, it's not comfortable to sit in the same position for a long time. So you're encouraging movement. See, this is a great one, the 90-90, and it's probably so hard for most people that sit on couches all day. But when you're sitting on the ground, you're being forced to move into different positions constantly. And that's what's keeping that blood flow, that oxygen, that hydration, and everything that's going. And you ask, what is it supposed to look like? And it reminds me of a question from a doctor, right? Because it's like, it's going to look different for me than you. Don't focus on what it's supposed to look like. Focus on what it feels like, and most likely, just like when I was suffering from my worst knee pains, that squat sit was the hardest thing for me to do. I was trying to sit into that squat and my knees were buckling in and everything hurt so bad. And I just breathe. I just stop and try to breathe and relax. And eventually I got to be able to sit into this position longer and longer and longer. And for those of you guys know, I usually have a lot of athletes that come and stay in my house and train all the time. So recovery and feeling our best is extremely important. And we look for every excuse to sit into that squat sit. Because when you sit into that squat sit, you're literally nourishing and replenishing all of your joints and ligaments from your lower back all the way down. You're improving your digestion. That is a natural human being resting position, is that squat sit. So you can really rebalance and reharmonize everything that you're doing. So if my legs are tired and I'm sitting in line, I'll sit in a squat sit for a few seconds. Or if I'm waiting, I'll try to find every reason you can just to get low to the ground and try to keep lowering your sitting position, to get your heart closer to your feet. It's like when you get injured, say if you hurt your ankle, they tell you to lay back and to raise your ankle up so the blood flow can flow better to your heart. And being on the ground is the same position. Your heart is so much closer to your feet. If you can't touch and have a good, close relationship with your feet and with your calves, most likely your heart is having a hard time pumping that blood and nourishing that spot as well. So get close to the ground, get low, bend those knees as much as you can so you can keep bending those knees as we age.
And you still want to be aware of stacking while you're in the seated position of the squat sit, right?
Yeah. And in every position, doesn't matter if you're sitting, having sex, making food, same thing. If you're sitting here, you don't want to be sitting like this, right? But when you're on the ground, at first, this may be all you have. That's okay. So that's why I don't want you to focus on what it looks like. Just focus on here and doing the best you can, trying to raise that head and stack those bones. And then all of a sudden, you'll notice that your senses are better. You're seeing clear. You're thinking clear. You feel better. You're breathing better. Because when you're here, it's making it so much harder for you to breathe. If this is here, it's most likely it's going to drop your mouth and then you start mouth breathing right from your chest. But when you sit up nice and tall and align that spine, breathe through the nose, you're able to transfer that energy and those nutrients so much better throughout your body.
Yeah. So this is essentially a habit breaking intervention. I mean, we have been sitting and doing movements, maybe even from a repetitive standpoint, without any awareness whatsoever. And it's no different than changing your diet and how hard that is, or changing an exercise routine. This is on the same level of difficulty in changing nerves that fire together, wire together. We've got to rewire the way we think about movement.
Yeah, I definitely think changing your diet is a lot more difficult because it's like you can't help. You have to eat, and there's sugar and what I call drug food everywhere, But, the thing is, if you want to learn how to move, look at somebody under 5 years old. They're moving perfectly. They sit into a perfect squat sit. They have perfectly stacked bones. They lay on their back. They breathe through their stomach. They're moving perfectly. And it's the stress that hikes our shoulders up. It's the chairs that bring our shoulders and head forward. And it's the bad diets that do a number on our breathing patterns and our posture. So those three things, as we get older, it's kind of what we have to almost reverse that process of coming back to our perfect nature. And that's when we were kids. And, learning how to move better is everything, is really so important. And it's just a level of awareness. Every single person, it doesn't matter if you're trying to move better or not, you should be trying to improve your awareness. and prove your presence. And the way you're moving is the perfect, simplest, easiest way to just come back into the present moment of understanding where you're putting your shoulders and your body. And, and at first it seems like it was consuming a huge percentage of my thoughts, was just trying to align my body constantly. Because one, I was in a lot of pain. If you are in pain, this should be your number one priority. Because if you're in pain, we all know if you have a little aching back, that may take 40% of your intelligence and your presence away from whatever work you're doing or whatever of relationships that you're trying to excel in. So take care of your pain first. And then past that, it's just becoming more aware. Becoming more aware is literally everything. And it's going to not only improve your movement, but all aspects of your life. Is knowing, are you breathing through your mouth? Is your head in front of your heart, or are you leading your days with your heart and with your chest? Is your bone stacked? And it's just a good practice of presence, to where before like I said, I had to think about it all the time, but now, like, I'm okay. Like every step that I take, I know where all my toes are at. I know where my shoulders are at, and I'm not having to think about it because it's habitual at this point.
Yeah. So, Will, this time last year, I had to have wrist surgery to release my carpal tunnel because I was starting to lose feeling in the tips of my fingers. And it was
And that's
so bad.
related to your elbow.
What's that?
And that's so connected and related right to your elbow. And that's what it happens is then when you go to some, like, oh, my elbow's hurting, oh, my wrist's hurting, you get a diagnosis and a procedure.
Yeah, absolutely. And I got one. And, I was prepared to do both hands because my dominant hand was the one I had the surgery on. And then my other hand was also having very similar problems. I work in healthcare. I'm either on the computer or manipulating pharmaceutical agents all the time. So it's a lot of repetitive movements. And that's what the doctor said, that the cause of my carpal tunnel syndrome was my profession. And I thought that was interesting, that even as professionals, we need to be aware of something else, and that's repetitive movements that we do subconsciously without even thinking about it can lead to long-term problems.
Yeah.
You're an athlete. You go through a lot of repetitive movements. How do we protect ourselves from that?
Yeah. One, like, just like I said, aware of what your repetitive movements are. And floor sitting does great for just it may not do wonders on your hands, but putting your body through a full range of motion does wonderful things. And because sitting on the ground does great things, especially for your waist all the way down. But what about that upper body, right? Where you're talking about how the hands and the elbows and stuff like that, if you're on the computer a lot, sitting on the ground, it's going to help open up those hips, but maybe not so much your shoulders. So what can you do? Hanging or getting those arms up. It's the same thing of if you hurt your ankle and you lay down and you want to elevate your ankle so that blood flows. You want to raise those arms up as high as you can and spread those fingers as much as you can. Put your body through its full range of motion so it can nourish in those deep caves of what is not getting lit up and not getting turned on. So, for example, when I was 24 years old, my hands hurt so bad. They were one of my biggest complaints, was my hands. I've broken my hands so many times, and probably a lot of texting as well, to where it hurt to open my hand up past this. Like it was just crunched in. And I was so afraid because I was thinking, wow, I'm 25 years old. I can't even open up my hands or make a fist without pain. What am I going to do when I'm 30? I want to be working with my hands for the rest of my life. Now I have no pain in my hands in any single way. They actually feel better than they felt since I was a kid. And one of the things is, if you have carpal tunnel, just open, and then squeeze. Open. Spread your fingers out as wide as you possibly can. Reach out as far as you can. Go all the way up. Bring it down. And just putting that through a full range of motion constantly is going to get that nourishment and get that constantly realignment that's going to take care of that repetitive movement of here. So to really take care of that upper body, Edwin, I would buy one of those, either some rings to put out on a tree is probably the best thing. I think they're $30 on Amazon. And, we have like some gymnastic rings just hung on a tree branch. But if you don't have that possible, it's another just $30 to have one of the things in between your doorways, like the little hang bars.
Yeah.
And if you don't have that, Edwin, especially with all the time that you spend on the computer and sitting, and if you're going to get a wrist surgery on your hand, you should be spending 1 to 3 minutes hanging every single day. Because when you hang, you're going to decompress all of the joints from your fingers to your wrists, to your elbow, to your shoulders. You're decompressing and hydrating in all of those joints and ligaments.
Yeah, that is such great advice. And again, it comes back to this level of awareness that I think we lose. We've created a bad habit that is subconscious to our awareness. And it's not until we raise that to our conscious awareness. Joe Dispenza talks about this a lot. You are not able to rewire that habit until you bring the bad habit to your awareness.
Yeah, for sure. And like, so many of us are, oh, my shoulder's hurting. And then they go to a doctor and they're going to try to talk you into a surgery that they get paid $60,000 to $100,000 for. Same thing if you got hurting hands or hurting wrists. And you can call this an opinion, but I think my opinions are facts. But, but if something is not broken or completely torn, there's probably no need for a surgery, because you can reverse like that pain by fixing your movements and becoming more aware with hanging and squat sits and floor sitting and some sort of physical therapy. A good physical therapist, you can reverse that constant damage that you're putting on. And a surgery is needed if something is broken in half. If some ligament is torn completely, it's not going to just heal from better movement. Then you might need a surgery. But if something is this nagging chronic pain, become first aware of what movements you're doing to cause that. And if it is something like your job where you can't just stop doing, that's okay. Then that means in the mornings and in the evenings and probably every hour or so throughout the day, do some sort of movements that's going to help nourish and reset that imbalance that you're giving yourself from your repetitive movements. So like this, like if you have these wrist and elbow pains, Edwin, it's all connected. You want to be moving those wrists, opening up those fingers, hanging, moving those elbows through its full range of motion. Movement is medicine. When you're moving, you're healing, you're nourishing, you're hydrating.
I think we just found the title for our thumbnail. Movement is medicine. I like that.
I like that
a lot. So Will, help me out with something else. I'm being very selfish here. If anybody has any questions
if you guys have any questions about your hand pain, elbow pain, shoulder pain, back pain, knee pain, let me know where you're feeling the pain and what sort of repetitive movements that you're doing every day that you think may be causing that pain.
Yeah. So let's talk about driving in the car real quick, Will. I look at the anatomy of the seat that I sit in, and it looks really comfortable from the outside, but it's a bucket seat. So when you sit in it, it has a deep back, and then the shoulders are pushed forward by the edge of the back of the chair. And do you use anything in your vehicle to counteract that, to allow you to stack a little bit easier? Because I can move the recline backwards and forwards, but I still feel rolled over in the car.
Yeah, my muscles. So like you don't want to rely on some sort of device or anything to put you in a good posture, because then your body becomes reliant on that and you can't do it without it. So in the car, that's one of the most important times, where instead of here, use that steering wheel to bring that up, have that nice tall spine, and just focus on your breathing and your movement. And you'll notice instantly, if you're all crunched up like this and those shoulders, like I notice at least that, I'm seeing a little bit less clear. I'm seeing a little bit more blurry. I'm not, I'm thinking a little bit more from maybe my lower aspect, my survival self, as opposed to when I'm bringing myself up and I'm nice and tall, I'm seeing from my perspective in my world so much clearer and so much more efficient, because my body is not having to stress itself out, but it's becoming more aware of my surroundings. So yeah, just when you're in the car is the most important thing. What you can do is always try to think about having your head hitting the back of your seat, because that's what a lot of us do when we're sitting driving, is our head is just falling forward and we're just cruising like this. But one thing I do constantly is I try to push my chin back to where I'm like, every time I remember, especially if I'm on long drives, every 30, 45, 60 minutes, I'll actually engage the muscles by pushing my head back against the seat and then turning left and turning right to just engage all those muscles, to relax those muscles that are overworking by pulling it forward and bringing it back here. And then just bringing that chest out, core engaged, wiggle your toes a little bit. And if you're driving, a good trick that I tell a lot of the athletes that we travel with is, when you're driving for a long time, you want to do a couple things. One is, of course, chin back, the 6 posture checkpoints, but your glutes completely turn off when you're sitting. So you want to be engaging your glutes as much as you possibly can, just to keep them firing and get that blood and oxygen into that moment. Engage your glutes and give yourself a few pelvic tilts every 5 to 10 minutes or so. A pelvic tilt is like this. So if you're sitting in the car, you're driving, right? A few pelvic tilts are just putting your pelvis through the range of motion of
as if there were a rod going through both of your hip bones. You want to rotate it around that axis, right?
Yeah, on this way. Yeah.
Yeah.
Just moving it here and here. Just try to put yourself to that full range of motion on there, and then find that neutral, engage your glutes. It does wonders to actually see if you can flex one butt cheek at a time, like a high-paid stripper, right? And being able to do that off one butt cheek while driving, it's improving your awareness, it's improving your presence, and it's making sure that, your body doesn't just turn off and then, mold into that bad posture. So if you're driving, of course, the 6 posture checkpoints, move your pelvis, engage your glutes, and every single time that you can, if you stop for a piss break or when you step out of the car, instantly turn your spine. Turn your spine, because your spine is like your whole circuit board of your whole electrical system of your nervous system and everything. So turn that spine to nourish that and get that blood flowing, and that goes to all the extremities of your body.
So I notice you talk about spine twisting a lot. Go a little bit deeper there, because I think we miss that point a lot. We're more front and back in our movement versus twisty. Twisty doesn't sound right or look right.
Yeah, like so many of us think like our spine should be straight, right? And just like we're constantly moving like this all day. But that's not how our spines are designed. Our spines are meant to be mobile and to be moving throughout everything that we're doing. And the more movement that we can get through our spine, the more range of motion that we're going to have, and the more electricity and nourishment and hydration that we're going to be able to get throughout our whole entire body. So like, usually, if you're having back problems and if your back is hurting, it's because it's stiff. It needs to be moved. It needs to be nourished. It needs to flow through that ranges of motion. So by doing spinal twists, one of the best things that you can do, because when you twist your spine and take in deep belly breaths, especially through your nose, you're taking all of your internal organs and wringing out all that stagnant inflammation and blood and BS that's getting stuck there, to replace it with the good stuff. So by turning your spine as consistently and as often as you can, will just help everything else align better. And that's turning it this way and this way and this way and this way is just going to help your body align itself so much better when you can just turn your spine. And being able to even like move your spine in different positions, you can start playing with it. By moving your upper spine here, you'll notice that it's taking pressure off your shoulders. So most likely if you're here, it's because you don't have that range of motion to really move your shoulders and move your spine. So yeah, a healthy spine is a moving spine.
Yeah. So I guess that also, when you experiment like that, it helps you identify imbalance, because I don't
Yeah.
know if I look for imbalance. I don't compare the left to the right enough to go, oh, well, this shoulder has a different range of motion than this shoulder. I need to pay attention to that in my range of motion exercises, perhaps. Is that
So,
fair?
can I correct you for a minute?
Yeah, absolutely.
Or not that anything that you said is wrong, but when I talk about imbalances, I don't mean that your right hand is stronger than your left. Okay, because our right side is going to feel a little bit differently than our left because we just use it differently. But what I mean by imbalances is our body's on a pulley system, right? So if you pull one side, the other side has to release. And if you pull that side, the other side has to release. So for example, the bicep and tricep is probably like the simplest explanation, right? So if I go to flex my bicep, to do that, I have to relax my tricep. Not consciously, but my body just does it. If I try to flex my tricep, my bicep has to relax, okay? So in the same way as if all these muscles are tight here, then all these muscles back here are weak. And that's what I mean by the imbalances is you have some muscles that are pulling, that are too tight, that are pulling on muscles that are too weak and underactivated. And because of our modern day lifestyles of too much sitting in shoes, most of us are really tight on the front of our bodies and really weak on the back of our bodies. That's why to rebalance and to find that balance on our body, we have to engage our back muscles, engage our lats, scoop our shoulders, and engage our glutes, because that's going to relieve a lot of the tightness in our hips. So for example, if you're sitting a lot throughout the day, most likely you have really tight hip flexors. So you can stretch your hip flexors all day, and during that time, you'll be able to loosen up your hip flexors. But a smarter, better way is if you strengthen your glutes, right? Because for example, if your hip flexors are tight from all this sitting, to strengthen your glutes, at the same time you engage your glutes and do that hip bridge, you have to relax your hip flexors. And then that's what naturally brings balance. So that's why I talk about putting your body through a full range of motion. Everything from your wrists to your arms, to your hands, to your spine, to your knees, bending them all the way. When you put your body through a full range of motion, it does a much better job at rebalancing itself, as opposed to if you're out of a balance. When I mean out of balance, I'm really talking about some muscles just being too tight, pulling on the muscles that are too weak from too much sitting or shoes or, yeah.
Okay. So I know that you incorporate a lot of these movements into the beginning of your day. And I think that's such a great platform from which to step forward with your daily activities. We talk a lot about, from a nutrition standpoint, how to start our days better. And from a mental standpoint, I don't know if too many people get out of bed and immediately get into a movement routine before they go get their coffee and sit some more. So you've been a proponent of that for how long?
It was about maybe 3 years ago at this point when I was becoming aware, because I had pains in my ankles, my knees, my back, my neck, my hands, my shoulders. I had pains everywhere. And I started first becoming aware of how all these pains had because of my posture and my limited lack of movement through full ranges of motion. I created a list of all of these easy movements that I could do throughout the day to combat that repetitive movement. So for example, if I had tight hip flexors, I knew I had to engage my glutes and, stretch my quads or engage my glutes. Or if I had a tight chest, I had to hang. But it became kind of daunting when I was just like, okay, I still have to hang today. Okay, I still have to sit in my squat sit today. But if I just woke up in the morning and just put it all before I grabbed my phone, before I grabbed the coffee, I not only felt so much better because I'm being proactive with my energy, but it set my body in a better position to move throughout the day. So I just started feeling so much better of when I wake up in the morning, I like to spend 30 minutes when I wake up, before I grab my phone, before I grab coffee, before I go to work, before I do anything, spend 30 minutes on a mat, just breathing and moving into whatever my body is speaking to. I have a base routine, but I'm always switching it up on how I'm feeling that day. But yeah, to wake up in the morning and to turn your ankles. Turn your ankles through a full range of motion. Turn your knees through a full range of motion. Move your hips, move your spine, open up your chest, turn your spine, and, move throughout your body. You're going to nourish and hydrate, because sleeping, you're sitting still, right? Everything's kind of sitting still. So to wake up and I'm pretty sure we might be the only animals on this planet that don't wake up and stretch first thing in the morning. We all have dogs. Most of us have dogs or cats. The first thing they do before they even get out of bed is they go into a downward dog and then an upright dog, and they do a little bit of a yoga. They stretch out their hip flexors, they engage, their core, and they engage their glutes. I see my dogs do it every single morning, and most likely if your cats have been lying all day, when they get up, they start to stretch. They put their body through that cat-cow and they nourish their spine a little bit. Pretty much all animals do this besides us.
Interesting, Will. So we've covered a lot on breath. We've covered a lot on movement. There seems to be something else we can talk about next week that I know you're passionate about. What could that be?
Nourishment. Nourishing our body and nutrition. And we're even going to go a little bit on how to grow our own food, because the best possible foods that we can eat are the foods that we grow in our backyard from, our hands and our soil. And, because then we know it's not loaded with the chemicals, and we know it's organic, and we had a part of growing that. So it tends to nourish us just so much more.
So, Will, of the 17 episodes we've done, I think I'm going to like this 3-part series the best. I mean, we've gone deep into breath, deep into movement, nutrition. I know a lot of people have a lot of repetitive movements in their nutrition pattern that create bad outcomes in their body and in their mind. So that's going to be awesome. And I love when you cook and post those meals. You think we could have a cooking episode next week where you just pull up and make a Will Grant recipe right there for us and talk us through?
That's a pretty good idea. Yeah, put in the comments below if you want to see me actually cook on live. I'm really not the best cook. I just take what's available in that moment and I throw it together and I spin it into something. But yeah, I feel like so many of us are just confused about what to eat. There's so much information coming from this way, coming from that way. Is meat bad? Is meat good? Are eggs good? Are eggs bad? Should I be vegan? Should I be paleo? Should I be, herbivore? We don't know what to eat. And,
it's all extreme.
Yeah.
Extreme nutrition.
Yeah. So I'm really excited to really clarify how we can truly eat to nourish our whole system.
Yeah, I think there are just a ton of questions around that. We feel hunger, feelings being the language of the body, and we need to go feed the body. We open our cabinet. Sometimes it's hard to know what to put together that makes the most sense right now. And you know what? That's an awareness problem of what you have in your refrigerator and in your cabinet. Maybe that's where we start. Maybe we need to go shopping with Will Grant. Go to the grocery store.
I actually have a couple episodes on YouTube about shopping with Will Grant. And in my course on the Happy, Healthy, Strong in 6 weeks, I have 2 or 3 videos about shopping and cooking and, all that stuff as well. But yeah, it's you go to the grocery store and it's so hard to tell what is healthy, what is good, especially with all of those boxes and containers saying low fat, no sugar added, healthy, heart healthy. I don't know how they can put heart healthy on Cheerios. Cheerios are probably some of the most toxic food that you can possibly eat, of just glyphosate, pesticide filled, antibiotic loaded drugs, and then they're fed to us as heart healthy, which is just completely BS. And, it's just people with a lot of money taking advantage.
And it's just so simple. I open the box, I pour, and I can eat. There's no prep, Will. That's the answer. We've got to hack eating to make it easier and nutritious.
Yeah. There's very little shortcuts in quality.
That's the problem. We don't know that.
Yeah. There's very little shortcuts in quality, but I mean, I'm pretty confident. I'm pretty sure if you stop and if you actually do spend an evening and doing the best you can, cooking a meal, putting in the best ingredients, try to make it as delicious as possible, and cook for a loved one or a family, that feels good. Like, that's rewarding. They're grateful. They're thankful. You actually did something to really contribute and, and help not only yourself, but the people you care about. Like, I highly recommend just cooking for somebody this week. And I think Aaron Alexander posted something this week too about cooking for somebody. And it's a really great thing to do, to not only get that quality nourishment, but that quality emotional connection with your friends, family, and even the food that you eat tends to nourish you a lot, in a lot more ways than you think that are inside the original box.
Absolutely. So, will the components of your happier, healthier, stronger course include a lot of what we've talked about? And I think it has been a pivotal transformation moment and an epiphany bridge for a lot of people. And you've allowed people to gain access to your course, through purchasing it, but you're also challenging people here on the show.
Yeah.
What's the challenge for next week with movement, perhaps?
So this week, since it was all about movement, I want to see you guys waking up and moving your body. I want to see, put your phone up, make a little time lapse. And that's one of the best things, not only to encourage, the people who follow you or the people that you care about to get moving their body, but it's really good to become aware of how you're moving by just videoing how you do move. So set up your phone, keep it on airplane mode. I recommend, so it doesn't distract you, but set up your phone or something to record yourself moving every single morning. Put it on a time lapse, post it on Instagram, Facebook, post it on your story, tag me and Edwin, and I'm going to pick one person who I really see is putting in the effort, moving and using their body through a morning movement routine. And I'm going to give my course away to one lucky person in next week's chat about nutrition.
Fantastic. So everybody knows Will Grant at the Will Grant, right? That's your new Instagram
Yeah, my
channel.
new Instagram is at the Will Grant. Post just some sort of movement work, just practicing becoming more aware with your movement, getting on the ground, doing some sort of floor sitting. I want to see videos or pictures or something of you guys on the ground connecting to your body.
Excellent, Will. Well, also tag at Disrupt Comfort, because that is exactly what we're trying to do, is disrupt your comfort zone and
Yes.
do something different so that you have a different outcome. Will, this
All
has been a
growth
great conversation. What do you want to leave people with?
Yeah, all growth is just right outside our comfort zone. All growth and all learning and all progress is just right outside our comfort zone. If you look at human history, nothing great or even semi-great was ever accomplished by anyone in their comfort zone. They had to push outside of what they normally do to get something that they haven't gotten yet. So if you're in pain now and you want to feel better, that journey isn't supposed to be comfortable. Comfort is what got you into the pain. So be able to step outside of that comfort and, and that's what builds that mental and physical strength to be able to expand that comfort zone. Because our comfort zone has a direct correlation with how successful we will be in every single area of our life, if that's relationships, business, health. So the more we're able to expand our comfort zone, the more we will be able to expand our opportunities.
Absolutely. And when we depart the comfort zone, just know that we're going to bump up against the terror barrier. You're going to feel like you're doing something wrong. Your body and your mind are going to try to keep doing what they're used to doing. And you remember where nerves fire, that's when we wire really heavily those conduits of activity in our brains. And that's going to be uncomfortable. That doesn't mean something is wrong and you need to stop and revert back into comfort. That's a sign, a compass point that you're doing the right thing. So bump up against the terror barrier and push
Yeah.
through it into growth. Great
Yeah.
advice, Will.
I like to think of it as just like a dance with that comfort zone, because like you have to know what makes you uncomfortable. And then, like you said, just rub up against it a little bit, seeing where you are with that comfort zone and feeling that comfort zone out and just keep pushing that a little bit further is the way to really expand the comfort zone, expand your opportunities, and really flourish into your best self.
Fantastic. Well, Braden, Jenny, thank you too for being here the longest today. We really appreciate you showing up. We hope to see you guys next week, and be sure to invite your friends. We'd love to have some positive influence in your communities as well. Will, let's close this out. This was another fantastic episode of Chat with Will Grant. Thank you, brother.
Yeah, thank you so much. Thanks everybody for coming, and thanks for watching. And yeah, give this video a share with anybody that you know is suffering from any sort of body pain. If it's shoulder pain, knee pain, back pain, and someone that you care about that may be spending a little bit too much time sitting in some bad posture, show them this video, and let's spread the good news around.
Fantastic. Until next week, peace out, everybody.
Later.